Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Have you ever thought about where your tongue is resting right now? I know that sounds like kind of a weird thing to talk about because we don't really think about our tongues very often, but that one muscle can influence things like your sleep, your breathing, your jaw development, your energy levels, even your anxiety, something I have personally struggled with. Today, we're going to talk about myofunctional therapy and why it's connected to so many common struggles that honestly we've just kind of normalized. Things like poor sleep, chronic fatigue, TMJ and jaw tension, headaches, mouth breathing, hormonal dysregulation. Hello, cortisol. Every perimenopausal or menopausal woman knows about cortisol. But also things like kids with crowded teeth, ADHD-like symptoms, snoring, sleep apnea, muscular tension, and babies who struggle with breastfeeding. Those are all things that we hear about all the time, and yet we don't really know to connect it to our mouth. But what if these issues aren't just random things, but they're actually structural and functional? So this conversation might completely change how you think about your health and your kids' health. Kristi Dobbs is my guest today. She is a dental hygienist and myofunctional therapist. Thanks for joining me, Kristi.
Yeah, thanks for having me.
Yeah, so excited to dig into this. I was just sharing before we started recording that I think this is going to be a new topic for a lot of people. So I'm excited that we get to um, really kind of bring awareness to this topic. I immerse myself in the health world, and it is something that I am hearing about a lot lately. And the more I hear about it, the more I think this is really important. It was like it's crazy how much it impacts your health. And so, thank you for coming on and joining me on here to explain this. So let's just kind of define what it is. How would you define what myofunctional therapy is?
Sure. So myo is meaning muscle, and functional is like the functionality of how things work. And then therapy is a session that you would go through with a practitioner. So break it all down. We're working on the muscle function with someone that's helping you do that. So the easiest way I explain it to patients is it's basically like physical therapy, but we're working from the neck up. So we're working on all the muscles of the face, jaw, the tongue, and the soft palate. A lot of patients forget that the tongue is a muscle. The soft palate, which is in the back of our throat, is an actual muscle that you can make do movements as well. And so it's tying all those things together and getting, same way that bodybuilders want to build up big biceps, we're trying to do the same thing so that we can tone the tongue, tone the soft palate, and then work on the muscles of the face too, because those are the main structures that hold everything in place for us.
Yeah. And would you say this is kind of a new thing or has this been around a while?
It's been around a while. I'd say probably for the last 10 to 15 years, but it hasn't gotten, quite popular until about the last 5 years.
Mm.
I'm usually honest with my patients. If I would look back and tell myself that I'd be doing myofunctional therapy 5 years ago, I would have laughed at myself because it just seems almost kind of like voodooing magic. Like, how can you just work on these muscles and you're helping patients? But until you start learning the process, teaching your patients how to do the exercises and you're seeing results, it really opens your eyes to a whole new world of airway dentistry.
Yeah. So, I mean, being around 10 to 15 years is a while, but not really. I mean, hasn't been around 50 years, so it is kind of fairly new, I think, as far as being something that is really like available to a lot of people, and something that is even needed. Because like maybe 50, 60 years ago, it wasn't something. Do you think it's something that people just didn't need as much back then? And it's more of a problem that we have today, or do you think they just weren't recognizing it back then?
Well, unfortunately, just with our modern diets,
Mhm.
and the way we've kind of, processed our food, we've given babies, formula earlier, baby food earlier, and
Yeah.
so jaws haven't developed quite correctly. And so, really, if you think back to early times, wisdom teeth were more prominent in the mouth. We had wider, broader, square shaped jaws. And even myself, who went through some palate expansion as a teenager, I still have that long face, kind of more narrow jaw. And again, it's just because even as a 45-year-old woman, I still went through those same protocols of, I was breastfed, but yet my mom started me giving rice cereal at like 3 months, baby food at 6 months, and then, so on and so forth. Braces as a 13 to 15-year-old. And then immediately after braces, it was no questions asked. You went to have your wisdom teeth removed. And so we've really kind of messed up our jaws. We need to go back to the basics and hit, and that's what we try to do in our office, hit on children from birth so that we can help with that jaw growth and development. So
Mhm.
that's been the biggest change, literally, is our diet, and just the changing of the facial structures way too early, earlier than what we really need to. And so, yes, myofunctional therapy is needed now. I would say there's probably 90% of the population that could benefit from some form of myofunctional therapy. They may not be tongue tied, but they may have TMJ problems. Again, wisdom teeth were removed too soon. They may have chronic issues of sleep apnea, plantar fasciitis. You named a few at the beginning, and there's a whole laundry list that I could go through. But until they recognize those and they're having issues with those, they don't start digging down the rabbit hole of how myofunctional therapy can help them.
Mhm.
Other thing that people just don't realize is that that fascia that's tied up underneath the tongue, it literally runs down to the tip of your toes. So stretching those muscles, honing those muscles, toning those muscles is the reason why myofunctional therapy is effective.
Yeah. Oh, thanks for explaining all that because that was definitely one of my questions is, what are the factors that are causing people to have all these jaw development problems now? So I mean, you hit right on it. And those are some that I have heard as well, like um not breastfeeding as much or giving the soft foods to our infants instead of letting them chew on something that will help develop their jaw properly. The tongue tie, so that our tongue can't push our palate out to develop properly. Yeah, so lots of contributing things, but it's pretty crazy, like that 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 diet can affect your mouth that much. That was a big eye opener for me.
Yeah, I mean, we were used to chewing meats more often
Mhm.
giving babies bones to kind of teeth with, and we just don't do those. We've made life too simple. When really simpler before, we tried to simplify it, but we've made it worse over time.
Yeah. You kinda hit on some of the symptoms that people feel as a result of these development issues, but maybe we could just kinda go back to that and give people a little bit more of a list to really make this relevant because and I tried to give people some in my introduction too, but I think we should talk about that a little bit more, so people realize how relevant this is, I guess. And so some of the one you just mentioned is plantar fasciitis. How is and that's connected because of the fascia that runs from your tongue?
Yeah. That fascia that runs from under the tongue, especially we see that in patients that are severely tongue tied, like a grade 3 or 4. And I can get into classifications a little later too, because that tongue is so tethered down to the floor of the mouth that there isn't much of that fascia that's able to stretch. And so staying tight keeps everything else tight, which is it's like a domino effect from the top of the shoulders down to the bottom of the feet. And I've got a whole laundry list of signs and symptoms if you'd like
Oh,
to
yeah.
add a buzz with
Yes, let's do it.
uh, narrow palate, gummy smile. Again, when I smile, it's one of those things that the lip goes up just a little bit too far and you can see too much. We don't have the right attachments in the mouth. Long
Mhm.
face, the facial features that are a little bit flatter, small, lower jaw or chin, the vertical angle to the mandible. Again, we talked about this. We need to have more of a square shape. Mine, as you can see, is a little bit more of that like kind of triangular vertical shape. Again, I've got myo issues too. Um, Short upper lip, the asymmetries in the face. Sometimes you'll see where patients will smile and they'll smile with one side that's up just a little bit further. Again, we've got to hone muscles and get things tightened. Um, Deviated septum, crooked nose, dark circles under the eyes, sucking and oral habits, speech problems, allergies, nasal congestion, digestive issues. It's a huge one. Sleep apnea, tongue tie. Sometimes it's just the buccal or lip ties, which are the attachment of the upper lower lip. And then if you pull your lips out of the way, there's little attachments that are on the sides. Those are those buccal ties that hold the lips and cheeks in. Snoring, TMJ, TMD, sleep disordered breathing, and then grinding and clenching of teeth. And that's literally just to name. I mean, that's a good handful, but that's a lot to see.
Yeah. And so it could be, I mean, this isn't just like a adult or kid thing. I mean, kids and adults can have these symptoms.
Yes. So of course we love to hit on kids right away. I mean, we have patients that are either seeking us out or they're just regular patients from birth to hitting those early tween years. Those are crucial for jaw growth and development. So we really would like to hit on that growth time, especially more so than for adults. As adults, especially for women, typically we're matured by the age of 16, 17, 18. Men can go a little bit longer between that 16 and 20-year range. But once you've hit that, the jaw is set and it's developed. Again, to kind of hit on what I mentioned before, back when I was a teenager, they didn't put braces on teeth until you were a teenager. There was no jaw growth and development help. It was basically like, okay, she's 13, put the palatal expander in there. We'll try to widen that palate as much as we can. You don't get much jaw growth as a 13-year-old girl. You're on that downhill slope of growth. So you don't get much development from it. And so unfortunately, that's why we try to hit as early as we can so that we can keep those issues from happening. And then as teenagers, if they've already developed and still have, bone structures that are set and into adults, we're not able to help with jaw growth and development, but we can still work on correct posture of the tongue and jaw. We work on jaw balance, and then we can also kind of improve the muscle tone, as I mentioned, with tongue and soft palate.
Yeah. I've read some incredible stories about this kind of therapy really helping kids that have behavior issues, like ADHD type of symptoms. Can you kind of explain the connection there?
Yeah. So, and I'll hit too. So when I was going through my list, a lot of times, like the digestive issues,
Yeah.
and out of 10, I will have a parent when they fill out our myofunctional therapy assessment form that says that they're a picky eater or they're particular about certain textures. It's because typically it's because they are tongue tied, but it's usually because they've got some sort of food aversion. It takes them too long to chew, especially with meat. Vegetables that are a little bit harder. If their jaws have to keep working and working and working, they're tired of eating, so they don't want to do it. So the food aversions is a big deal. The digestive issues, sometimes they're swallowing their food more whole, so it takes longer to actually digest the food as well. So again, those are things that we can kind of help improve because we're working on muscles. If the tongue is tied, again, a specific procedure will have to be completed. We do a frenuloplasty in the office where we're actually releasing that fascia that's underneath the tongue, that frenum attachment that's there. And once that's done and you give freedom and then reteach them how to have correct nasal breathing, oral posture, toning the muscles, you really get huge implications out of it. And then to go back to like the ADHD and like behavioral issues, a lot of times they're not getting enough air. And one thing that I'll hit on really quick, I got to pull up my cheat sheet here because can't remember all the statistics, but one of the things that nasal breathing helps us do, and again, we work on this through myofunctional therapy, it helps with that nitric oxide exchange. And it's literally 80% of our population does not exchange the nitric oxide properly. It says breathing through your nose is one of the most beneficial things you can do for your overall health of your body and for your longevity. This is huge. We see this in patients with behavioral issues all the time. There's something obstructing the airway that they're not able to nasal breathe correctly. And when you don't get that proper nitric oxide exchange, we're not getting that need of that nitrous in our body to exchange with things with oxygen and carbon and all the gases. And it really is, it's something Again, just off the wall, most people just don't think of.
Yeah. And it affects their sleep too, which would then affect their behavior as well because they're not sleeping well, even if they're technically in bed and you think they're kind of asleep for, 8 to 10 hours or whatever, that quality of sleep could be worse than you think.
And, a lot of parents, "Oh, it's so cute. They sleep with their mouth open." It's not cute. If they're sleeping with their mouth open, they are not nasal breathing. Yep. And they're not getting that nitric oxide. The nitric oxide exchange is it happens mostly in the sinuses. So if they're breathing through their mouth, we know nothing is getting up into that sinus cavity to help with that exchange.
I think it's also really important to nasal breathe for like allergy type reasons because our nose was meant to filter more allergens than our mouth. And so people that have like swollen tonsils and adenoids and things like that often related to allergy issues, it's because they're probably mouth breathing more than nasal breathing.
100%.
Yeah.
Yes, it is. Yeah. Our nose, it's got a natural filter on it that needs to be used.
Yeah. And then the connection to hormones because I think it's if correct me if I'm wrong, but from what I understand is, kind of the similar issues with the digestion and what's the other topic we talked about?
Like plantar
Sure,
fasciitis.
ADHD, like behavior type issues. It's just I mean, for one aspect of it anyway that makes sense to me related to hormones is that if you're not sleeping well, then it's going to basically put your nervous system in overdrive because you're not resting and recovering like you really should in your sleep time. So that kind of kicks your nervous system and your cortisol into high gear, which affects your weight gain and other hormone regulation and things like that. Am I correct about that? Is there any other hormone or type
No,
of?
that's the thing. I think most people know how crucial sleep is. I mean, we need those 6 to 8 hours to allow our body to reset. We need our body to go into the autophagy phases. I mean, our cells need to replicate. There's lots of things that are happening during sleep. But if we're not giving ourselves that correct oxygen exchange, we're not getting good sleep. And yes, especially women, if we're, pre menopausal, perimenopausal, it is. It's tough because we've got such an influx of hormones that are changing things. Again, you mentioned the cortisol levels; those will especially spike in the middle of the night, and we're awake 1, 2, 3 o'clock in the morning. So again, it may not mean that we're mouth breathing all the time, but it could be a piece of the puzzle that's causing extra issues on top of it.
Hi, friends. I want to tell you about a new resource. Did you know that breast cancer is a problem? Of course you do, because 1 in 8 women will receive a breast cancer diagnosis. And we all know someone personally who's been affected by this. I started taking this pretty seriously a few years ago when I decided that I really wanted to come up with a breast health plan for myself. But when I went to look for information on how to do that, most of the information out there for women is about screenings and detection and not prevention. Knowing what I know about health, I knew that there had to be a way that I could really make my body resistant to disease and make my breast resistant to disease. After years of research, asking questions, learning, come to find out there actually is a lot that we can do as women to be proactive and pursue breast health 365 days a year. So I have decided to put this information into a guide because I really just don't see people talking about this. And I think women deserve to know the things that we can do that will really impact our health and reduce our risk of diagnosis. We talk about all kinds of things, and I get into over 30 pages worth of tips and practical things that you can be doing in your life that will really make a difference. And I really think that this can not just make a difference for you, but make a difference for the future generations of women in your family. If you want to learn more about this, it's called the 365 Breast Health Guide. You can get the link in the show notes, or you can go to dailywellnesscommunity.com. Yeah, that makes a lot of sense to me. So, can someone still be pretty high functioning and still need this therapy?
Yeah. So again, God created us very intimately, and we'll find a way to compensate. So especially in kids, and I can attest my second daughter, she's 15 now. She was tongue tied when she was a baby. I knew she was tongue tied as a hygienist. Took her to the pediatric dentist. She's okay. Took her to the pediatrician. She's okay. She's nursing. She's this, she's that. As she got older, same thing. She's talking, she's functioning, no problem. Well, it wasn't until she was a early teenager she started cheerleading in school, and she couldn't get her high V's into the correct position. So she was getting on, the cheer coach was getting on to her the whole time. Get your arms up, get your arms up, get your arms up. And she's like, this is as high as I can get them. So, and this was before I had actually started working with Dr. Roberts. Well, once I came here, I mentioned to him, and this is when we very first started our Airway journey in the office. And he said, yeah, it has to do with that tongue tie. So she won't be listening to this. So I will tell you, she was our first guinea pig that we used in the office because Militia, she was a class 4 tongue tie. I mean, tethered down so tight.
Okay.
And never any speech issues. No one ever corrected her in school. Nobody ever sent me anything as far as having any issues. But I'll tell you what, we did her tongue tie release that first time, and those shoulders went back. Those arms could get up into that position that she needed to be in. And even so, she had it done when she was 12. And even as a 12-year-old girl, she goes, Mom, I would have done that again in a heartbeat because of the changes that it gave to her. And so
I
that's
love
just a
that.
that I can give that, I've gone through watching my daughter do that. Um, we don't think of that as parents. Like I mentioned before, sometimes, especially as babies, the parents are like, oh, look at them. They're so cute. They're sleeping with their mouth open. Well, go over, shut that mouth, get the jaw to develop right, get that tongue. The tongue is basically our natural retainer to hold that upper jaw and get it into place. So if the tongue is in correct place, it's going to help with that proper jaw growth and development. So if you're tongue tied, that tongue is not going to get up into position where it needs to be.
So, I mean, even in your daughter's story, and I've heard this from other people too, why do you think that practitioners are hesitant to address tongue tie issues?
I mean, I hate to say it, but it's just, and it takes a specialized care. So, like in our office, how Dr. Roberts really wanted to kind of start focusing on some airway dentistry. It was kind of taboo. I mean, especially for dentists. It was the buck was passed on to the ENT, the ear, nose, and throat specialist was like, well, they're the ones that look back there, make them responsible for finding out if it's tonsils or adenoids, which I will say again, go 20 years back, 30 years back, tonsils and adenoids were taken out like that because they're snoring, they're mouth breathing. It's got to be an airway obstruction. So usually they thought that it was tonsils and adenoids. And we're finding now that there's specific tonsil protocols that you can go to help shrink those, shrink the adenoids, open the airway a little, then do some myofunctional therapy to see if it helps. Sometimes they do still need tonsils removed and sometimes they don't, but it's one of those things that we now know what we know.
Yep.
But to go back to like the realm of airway dentistry, dentists weren't focused on that. Yes, they pretty much treat from the neck up, but it was looking for cavities, looking for periodontal disease, looking for actual pain assessment and needs with the teeth. They weren't looking up the nose. They weren't looking in the back of the throat. I mean, I'll even attest, I've been doing hygiene for 22 years. I've never had a doctor ever come in to do a new patient exam and ever look in the back of their throat or up their nose until I started working with Dr. Roberts.
Hmm. I mean, I want people to think about just really how common these issues are. Like, go back and listen to that list that Kristi rattled off because these things are so common, and what we're what we're doing as like typical, standard of care ways of treating these issues aren't really truly fixing the root issue of why we're having these issues in the first place.
Right.
I before I knew about this, like, my son had his adenoids out, and then I learned about all this, and I was like, "Oh my gosh." Like, and he has other issues too, but, from your list, and I was just like, "Man, if I had known about that back then," so for anyone listening, my family goes to Kristi's office, so I know Kristi because she is one of our hygienists there at the office that my family goes to, so you guys have really helped us learn a lot and looked in all of my kids' mouths and helped us to understand kind of where we're at and what we need, and that's been amazing. But I would just encourage you to really think about what will benefit your child and even you, I mean, as an adult, obviously, the most long term. And if after listening to this, if you recognize some of these symptoms in yourself or your children, to really seek a second opinion if you have been offered like some of these procedures that are really band-aid approaches. Get yourself to an integrative dentist. If you're local to me, in Southwest Missouri, you can go to Roberts Integrative Dentistry where Kristi works. But there are more and more places like this where you guys can get help. And yeah, I just think this is like this could be a huge aha moment for a lot of people listening.
Well, and I tell patients the same thing, that they're right where you are too, malicious. Don't beat yourself up. Again, sometimes we have tunnel vision, and a lot of practitioners, they see what's black and then they treat what's white. I mean, it's everything's just black and white. This is the ailment, this is the cure. Same thing with, big pharma. It's they've got the flu, give them Tamiflu. They've got, this, give them this medicine. And so being more integrative, you're taking a step back from big pharma, big tech, big world, and saying, okay, let's take a look at some other things that could be causing this. Again, tonsils and adenoids could be a part of the puzzle. We
Mhm.
do that. We do our assessment in the office. Uh,
Yeah.
we use a screening. It's called the Ferrist 6. You can actually look it up online. It's a whole screen that we go through. Basically looking at mouth breathing versus nasal breathing, mentalis strain. Are they struggling to keep
Mhm.
their lips? We look at tonsils, we look at the tongue tie, we look at the wear on the teeth, because again, one of the things I mentioned was clenching and grinding. Clenching and grinding, they're wearing those teeth down, holding them together all day. So we're looking at wear, we're looking at the shape of the palate. If the palate is a little bit more narrow, they're not going to be able to get that tongue stretched up there. We want a nice broader palate. So we're looking at those things. And sometimes we do still have to send patients in for tonsil and adenoid removal. If they're that grade 4 and they're so close that they're touching, that airway is little, they've done the tonsil protocol, we've given them a couple months to kind of get through cold, flu, allergy season, and those tonsils are still grade 3 and 4, then yeah, we still refer them to the ear, nose, and throat specialist. But with that, I will say, one of the specialists that's here in Joplin, she does ablative. I think it's called ablative. Maybe it's I think it's ablative tonsil removal.
Mhm.
So with that procedure, they actually leave 10% of the tonsils that are there, because tonsils are still part of our filtering system, almost like the
Right.
lymphatic system. So if we can keep even just 10% of that tissue there, then it's still going to be beneficial for our health.
Right.
Uh, uh, Stimulating with the immune system and all those things.
Yeah.
Adenoids, and like with your son, sometimes they regrow even.
Right.
So it's not the end of the world for something like that, but that's why we are doing what we're doing, is because we're taking that step back. We're looking at the bigger picture. We're seeing if we can take baby steps to try easy things first before we have to go to the hard steps for
Right.
surgery.
Well, a huge part of this is just connecting the oral health to your overall health, which is like, duh, when you think of it, like your oral health determines so much of your overall health. But, in our culture, we have separated that so much. We have the dentist that does the teeth, and that's it. And he doesn't ask the questions that you guys ask in your integrative practice. And I hope that that is the dentistry of the future, where people are being more holistic with their dental care and thinking about the airway and things like that. But if you're listening and your dentist doesn't do that, I would encourage you to maybe see if there's someone in your area that does. And just try to reframe your own mindset around oral health, as being connected to the rest of the body. Because it's been huge for my family, and just my understanding of health in general. Like connecting all of those symptoms to things that are happening in my mouth. Like, what?
We're taught even early on when I was in dental hygiene school that the oral cavity is the pathway to the body. We put everything in our mouth. Everything goes up our nose. And so we knew that periodontal disease had a connection to like cardiovascular issues. We knew that having gingivitis during pregnancy was like an inflammatory type thing. So we see these issues. Again, it was the black and white that we saw before, but now the veil has been opened to airway dentistry to really hone in and focus on those different structures.
Yeah. I think it might be good to just kind of go over like all of the tools and therapies that you guys have, and kind of maybe process through those a little bit. So, I mean, we talked about a tongue tie release. So being one thing that you do, but what are some other things that you do in the process and tools that you
Yes.
use?
With myofunctional therapy, basically what we're trying to do, we're working on 4 goals. We're working on nasal breathing, just kind of break everything down. We work on nasal breathing. We want to make sure that that airway is open with the nose, because this is the number one way that we need to get that air process through. Lip seal. The lips need to be pressed together, sometimes especially with a lip tie, when that lip is like this and they can't get the lip physically together. We work on stretching the muscles of the lips too. Correct tongue posture. So the correct way that the tongue should be into posture is when you say the word night, meh, meh. The tongue goes up back behind those 2 front teeth, like you're getting ready to say that position. And then if you say the word king, ka, 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 the middle of the tongue needs to be in that position. So night, king, there's the tongue that needs to be up into the roof of the mouth. Those are the 4 pillars that we work on. And then we also have device therapy in our office. With a device therapy, we have a myo munchie. Again, just a quick Google search and you can find out about myo munchie. It's still through the we do everything through the Breathe Institute Myo Mentor. So it's in connection with both of those as well. Myo munchie we typically use from 6 months to usually around teenage years, if needed, just to help with jaw growth and development. That's a really easy device therapy that can be used. If we start with munchie and we see that we need to do some more, like if it's a baby and they've sucked on a pacifier for a while and they've got an open bite where the teeth don't touch, sometimes we have to go into the next device therapy, which is called myo brace. The myo brace is it's a little bit sturdier, a little bit stronger. It really helps to kind of press that palate out to get some expansion. Again, very non-invasive. And then the third device therapy that we do in our office, we don't do any traditional orthodontics. We do Invisalign, but Invisalign has come out with a palate expansion. So we can start palate expansion as soon as those first molars come through. So if we've tried device therapy, we've gotten to a certain point, but we need just that little extra kick and push. We can do Invisalign palate expansion to get that palate as wide as we can, and then start a little bit of Invisalign to get the teeth nice and straightened. Because here's the thing, braces were invented to make our teeth look pretty originally, and pretty is good, but we also need them to function properly. So,
Mhm.
excuse me, again, I might have a really pretty smile,
Very pretty,
but
Kristi.
function correctly. I'm really narrow still. Again, I'm 45. I'm not going to get much growth in my arch. But if you have lots of crowding, if the teeth are kind of overlapping each other, and you really can't get your tongue up into the palate, you have a really narrow lower jaw, we can help try to straighten the teeth out, help build that foundation, a good structure again. Because sometimes it's a structural issue too. If we can work on the foundation of that as well, then mix in some myofunctional therapy, we're honing all those things in. So, myo munchie, myo brace. If patients are having some TMJ discomfort, we have some appliance therapy that we can use for that. And then I'll jump in real quick with myofunctional therapy. So, again, I hit on the 4 goals that we're trying to hit with myofunctional therapy. Using those devices is still trying to hit on those same pillars: nasal breathing, lip seal, correct tongue posture, and then swallowing. But with myofunctional therapy, it's a time and then a monetary investment. So the time investment is huge. Most of the time I'll tell patients, okay, your insurance is not going to cover for myofunctional therapy. Unfortunately, that I'm hoping that in the next, 5 to 10 years, they will see it. It's kind of like implants. When implants first came out in dentistry, they didn't cover it. They considered it cosmetic. Same thing with myofunctional therapy. They don't see that as a covered portion of dentistry. So it's an expense. So you're going to invest in the finance part of it, but the time is one of the biggest things. So myofunctional therapy typically consists of 12 sessions. Those 12 sessions are done every 2 weeks. And it would be just like going to see your chiropractor or physical therapy to keep things in line and things moving. That's what we do. We're teaching our patients exercises, new exercises every 2 weeks. We implement in the device therapy of either myo munchie or myo brace. And then one of the third device, or I guess fourth devices that we use, and this comes with myofunctional therapy program too, is this is called a rim plenish or a myo nozzle. Again, quick Google search will pull this up. Any of those things can be ordered through the myo munchie site and the rim plenish site as well. What we do in our office though is when patients come in and they need a specific size of like a munchie, we'll try them in to make sure that they're getting the right size. We don't charge anything extra, no shipping, no handling. I know some people that are listening aren't going to be able to come to Southwest Missouri to grab a Myo Munchie. So that's why you can still order them online. If you're in this area, pop in the office. We are always more than happy to just even go over device therapy if it's something that a patient's wanting to kind of try to start with. But back to the myo nozzle with the rim plenish, it is actually just a really easy device that you can use to drink out of. And who doesn't carry around their mug all day? I mean, I tried two of these, either a 32 ounce, two of these a day. Pop this little straw on the top, and it works the posterior portion of your tongue and your soft palate all at the same time. So we've got lots of different device therapies that can be used in conjunction with myofunctional therapy, um, to make sure that we are helping our patients and benefiting them the best that we can. Again, starting as early as 6 months all the way up into adulthood. I mean, a 99-year-old walked in here and wanted help, we'd still help them. So
Yeah. And I know when you guys do tongue tie releases that you do the myofunctional therapy in conjunction with that. Is it are there disadvantages, like, if somebody just goes and gets a tongue tie release but doesn't do the myofunctional therapy, are they at a
so the
loss?
reason why we do the myofunctional therapy, again, I'll do it is like a bodybuilder would, kind of analogy too. So you're trying to build those muscles, you're trying to hone and tone those muscles. You wouldn't want to just uh, lift a couple of weights and then go do a weightlifting competition, a week later. It's the same thing with the tongue tie. We've got to lift those muscles. So especially with tongue tie, we've got to stretch that frenum under the tongue. We want to try to get it as stretched and as thin as we can. It's like a little rubber band. It's tight to start with. The tighter that you can get a scrunchie to keep going just a little bit more when you've pulled it out. So we do myofunctional therapy anywhere between like 4 to 6 sessions. Then we do tongue tie release. Then we do myofunctional therapy post tongue tie release, because once we give all that new freedom and the tongue has been detached from where it normally sits, we've got to retrain our patients how to place the tongue back up into the spot, talk, swallow. We go over all sorts of therapies to retrain that tongue post tongue tie release, and it's just so much more beneficial to do the exercises before and after.
Yeah. And you mentioned orthodontics, so I wanna touch on that. If you have someone that's considering orthodontics for themselves or their children, what advice would you give to them thinking about functionality and airway?
And again, that is a huge base structure. That's the foundation of where the tongue is sitting. So if they're a more narrow, crowded, um, uh, TMJ issues where the jaw isn't fitting correctly, their bite is off, then yes, orthodontic work. A lot of times, what we'll do is again, we assess our patients. Sometimes we start the Invisalign expansion and Invisalign before we even do myofunctional therapy, especially in kids, because we want their jaw to be set, then we're going to train their tongue where it needs to be. So we don't want to, jump the cart in front of the horse a lot of times. So those are things that we look at in the office. But yeah, absolutely, that is a huge foundational part of before you look at anything airway. We've got to get the jaw in proper placement. Sometimes
Yeah.
you'll have patients that are like a class 3 placement too, where they've kind of got that bulldog bite.
Mm.
So the jaw is nice and pushed forward, but we don't want the jaw nice and pushed forward. We've got to get everything nice and even. So again, setting those structures and getting that foundation ready so that we can then focus on the airway portion of it.
Yeah, we haven't been taught, if we have crooked teeth, we haven't been taught to ask why.
Yeah. And again, a lot of people think, well, my bite feels fine. I don't mind if my teeth are a little crooked. And sometimes that is the case. If the bite still looks fine, and we do special scans in our office so that we can actually check the bite, see where the teeth are touching, see if the bite is a little high in certain areas. Because if the bite is too high and the bite is off, the jaw is going to be off. And they could be, you know, teenagers, early adults saying, I don't have any problems, but then they work into those 40 and 50 years where that jaw has been misaligned and misplaced. Then they're going to start having some TMJ and TMD issues because they're wearing that cartilage in between where that ball and socket joint is because they don't have correct jaw placement.
Yeah. For somebody listening that might think this might be good for them, but maybe they have some, like, dental trauma in their past. What can you tell us about any pain related to these procedures or, things to be concerned about in that area?
Yeah, I mean, one thing that I will praise Dr. Roberts for is he's just we try to make the dental experience in our office a little bit more of a lesser anxiety. You know, we have softer music, more natural lighting. So we try to make it a more welcoming type of a lot of people come in and it smells like a dental office. So sterile in here. We try to keep it from being that. It's a totally different experience. A, from the time you walk in the door. B, there is no pain or anything that's associated with myofunctional therapy other than going through the tongue tie release. And with the tongue tie release, and again, I'll jump in with my daughter who was 12 when she had it done. The best way she could explain it is she said it felt like she had lifted weights for days, and you know how your arms just get so tired after you've done a workout or even just done squats for a little while and your legs feel kind of jiggly. That's kind of how her tongue felt. That was the best way she could describe it to me as a 12-year-old at the time. um she was still able to eat and function properly, and by day 3 she's like, "Mom, I want a cheeseburger." I gave her a cheeseburger. I mean, she's a 12-year-old. She knew what she wanted at the time. As adults, we're kind of a little we baby ourselves, I think, a little more, and we don't heal as quickly as children do either. So sometimes that can be a little bit painful. If patients are going through the Invisalign expansion, again, we are moving the jaw. So sometimes kids can experience just a little bit of discomfort with that, but there's never anything that's painful. Even when we do the tongue tie release, and I may be jumping all over the place with this, but when we do the tongue tie release, we use a laser when we do it. So it's basically cauterizing the tissue as it's doing it. So there's very minimal bleeding. If there is bleeding, then we're able to cauterize it on the spot by using that laser. So it's a very easy procedure. Now, Dr. Roberts does suture after his tongue ties. So best way I can explain it is if your tongue is tethered, we've opened it. We want to stitch that into the position that he's just gotten you into. You'll still get a little bit of regression and a little bit of tightness, but it's nothing like going into having the tongue tie release and then just having you walk out and say, "Oh, just let it do its own thing." It's going to try to reattach a lot lower. So we try to suture, keep it in a longer position. Only takes about 3 to 4 days to heal. We give all pre-op, post-op, everything that's needed. Once they go through the myofunctional therapy program, it's there for them. Um, one
This
thing I
kinda
did.
Oh, go ahead.
No, you go ahead.
Well, it ties into another question that I popped into my head, which is, after you go through these therapies, are the results lifelong, or is this something that you need to keep up with periodically?
It's still something. It's one of those, if you don't use it, you'll lose it. So that's what I tell my patients. Now, once they're through the myofunctional therapy program, again, the 12 sessions take about 6 months. That's what I was going to say. I didn't mention how long it takes, but you divide the 12 times 2. It takes a while to go through the program. Um, but it is one of those, if you don't use it, you lose it. So what I tell my patients when they're done with the program, it's not like you have to specifically sit down, take so most of the exercises are anywhere between 2 and 4 times a day. You don't have to sit down, devote that time to do the exercises. What I want them to do is pick maybe 2 days a week where they find an exercise that they want to do. So like an easy exercise that we teach our patients is clicks and TikToks. Walk around the house, clicking that tongue, getting it to stretch, keeping it in motion, using that myo nozzle, just the straw. That's such a easy, it's a very passive exercise. Passive meaning they're drinking from a straw. They don't realize that they're actually doing an exercise while they're doing it. So just keeping it nice and loose and stretched. Um, Soft palate, if we have patients that come in and they have issues with sleep apnea or snoring, if they're going to have to keep that soft palate toned. If not, it will get mushy and spongy and fall right back into the airway again. So it isn't something that they have to devote all their time to, and like they initially do in the 6 months of going through myofunctional therapy. It's just something that they'll want to do occasionally to keep everything nice and toned.
Yeah, that makes a lot of sense. Do you have any other kind of client success stories or surprising results from these therapies that you guys have seen in your office or you've heard of?
Yeah, like we've had two really great plantar fasciitis stories. So actually, one of my patients that came into the office, she initially came in for myofunctional therapy because she was having swallowing issues. I mean, choking just on her own spit with swallowing. So again, myofunctional therapy. She ended up needing tongue tie release, but in conjunction with helping with some of the swallowing, and she didn't even realize it, that she had never been able to wear like the what are those, like, Birkenstock shoes? I don't know what
Yeah.
they call them, but
Those? Yeah.
yeah, like a flatter soled type of shoe, like a footbed. I think that's what they call it, something like that. She's never been able to wear them. Had her tongue tie released. She was able to walk around barefoot and get her a cute little pair of Birkenstocks that she had never been able to wear before. It always had to be the nice, cushiony, arch support tennis shoes because she didn't realize how bad the plantar fasciitis was until after the tongue tie release. So that was a surprising result for her. And then almost the same exact thing happened. So we did tongue tie release with one of our hygienists in the office. And she said almost the same exact thing. Now, hers, again, is hygienist. We always have lots of head and neck tension. We're rolled over, working in mouths all day. So everything up between this SEM and upper shoulders are always tight. But hers were extra tight. I mean, tight enough that like the massage therapist was like, I can't even get in to massage that SEM. And after tongue tie release, that was the whole thing that she was working for. And she had some plantar fasciitis release with it as well. Again, nothing that was on the radar, but it still came up. So we've seen everything between the plantar fasciitis, head and neck tension. Again, my daughter with getting those high V's up there for cheerleading, not even realizing that those shoulders were so rolled that she couldn't get them back into position. So really, we've gotten patients off of CPAPs. They were using CPAPs for their sleep apnea. We were able to get them off of CPAP. Now, I will say not every CPAP sleep apnea is going to be a success story. Sometimes they either A, choose to stay on that CPAP because they're just so used to it, or B, they still will need that to help with a little bit of that opening of the airway just to make sure that they're getting the air through. But between body work, which at the beginning we had kind of hit on, I think maybe a little bit of speech or something. We want to play nice and sandbox with everybody. So I am always honest with my patients too. Sometimes speech will send them over to us for myo, and sometimes we'll have to send them over for speech if it's a speech issue. We want to work well with chiropractors, with massage therapists, because we want our patients to have body work done while they're having myofunctional therapy, because you just don't realize the release that happens everywhere. So that's one of the things that we really, like to work on too, so that they may in turn be coming here to get off a CPAP, but then have some issues that help with dizziness or plantar fasciitis or things like that. So
This is awesome. I love this. I'm constantly thinking, when I heard of this and some of the symptoms that can result as like with an underdeveloped jaw or bag tongue placement or, a constricted airway. I was going through these lists of being, and thinking about all my kids and myself and like kind of identifying different symptoms in us. And I think of, my friends that have reached out to me and told me that they're about their children's behavior or their husband's CPAP machine or their kids' allergies. And I'm just thinking like, again, like I said at the beginning of this, that this has the potential to help so many people with such a wide range of issues. So
it really does.
yeah. So I'm excited to have this resource out there. I hope that people can take this and start asking better questions of their own providers and really getting the help that they need. So thank you so much for sharing your wisdom. Is there anything else that we haven't touched on that you feel like we're
I
missing?
don't think so. I really don't. I think we've kind of hit on it and more than what I was expecting. So that's great. I love it.
Yeah, awesome. Well, thank you so much for your time. Everybody check the show notes for more resources. If you're not sure where to start for your next step, we'll have some things listed out for you there. Thank you, Kristi.
Thanks.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.